whenever you're ready.
Okay. Hi, thank you everyone for attending this Zoom to take a look at our presentations. The topic I researched was reproductive health. Uh, I, I was assessing the sexual health education quality in the Central Valley. A little bit about me. My name is Yusdivia Rojo. I go by she/her pronouns. I was born and raised here in the Central Valley my whole life. I'll be attending CSU Stanislaus this fall as a freshman. I would volunteer every once in a while in my community, but it wasn't until I joined a group called Minding Our Roots that really opened my eyes to the injustice happening in my own community. So ever since then, I've been determined to bring change to my community and help make it grow stronger. I do want to give a content warning. My presentation does mention rape culture, sexual assault, and sexual health and STIs. In my literature review, I found that it has been shown that queer students experience worse outcomes in mental health, physical health, and education as compared to their heterosexual peers. Some schools have made it accessible for students to get condoms at school as a way to help the prevention of sexually transmitted diseases and unplanned pregnancy. Abstinence-only education has been proven to be ineffective, and by withholding life-saving knowledge for students is putting them at risk. The United States is number one in teen pregnancy and STD rates out of all the developed countries. In 2011, a survey showed that 37% of districts in California reported no training requirement for sex education teachers. Um, I do want to give a disclaimer that most of my research for my literature review, I was only able to find research that is like probably over a decade old, as you can see here. The most recent one I was able to find was from 2015, and it was really difficult to find any that were pertained in the Central Valley. Something that I did learn that um, in 2016, the California Healthy Youth Act did pass, which required schools to provide every student with the knowledge and skills necessary to protect their sexual and reproductive health from unintended pregnancy, HIV, and STIs. Um, this required students to learn about their local resources for sexual assault and partner violence. According to the Bay Area Reporter, the state does not track what districts are teaching, so it is unclear just to how many school districts are complying with the law. I did want to give a disclaimer about my data. A majority of my responses did come from the Central Valley's social media posts, so I wasn't really sure where their audience mainly at, but I'm assuming since it is a Central Valley page, most of them were from the Central Valley. I did also share the survey with on my own social media, and most of my followers are from my own community here in Merced County. So the red means no, the blue means yes, and the orange I gave responders the option to say prefer not to say. So that's what the colors mean. I wanted to ask the responders if they felt confident that sex ed taught them everything and provided them everything they needed to know to have a safe and healthy sex life. 50% of the respondents said no. 21.4 of the respondents said yes, and 28.6 of the respondents prefer not to say. Um, um, from my literature review, I did find that most districts don't require their teachers to have any training to teach sex ed, which is why I asked if they felt their sex ed teacher was properly trained. Um, 70.6% said no. 23.5% said they did think their teacher was properly. Um, I also wanted to see if their schools were providing them the resources of how to prevent pregnancy and how to get access to those resources. 70.6% said no, they weren't taught about their options and where to find the resources. 29.4% said they were. Um, you can see that the respondents is the same when asking if they were given the options of what to do if they were to get pregnant. I was curious to see if they were taught about what consent is and isn't, and surprisingly, a majority were taught about it. 64.7% were, and only 35.3 weren't. Um, I also wanted to see if they felt confident that they were given the proper knowledge of STIs. A majority said no, but also, 47.1% did say they were. I was curious to see how inclusive their sexual education was, which is why I asked if they were taught about queer sex, and the majority said no, 93.8% said they weren't. I was also curious to see if they were taught about the sexual health for disabled individuals. 92.9 said they weren't. Um, I was curious to see if they were taught about rape culture. 68.8% said they weren't. 25% said they were. If you don't know what rape culture is, a brief description of what it is, it's one society that devalues the experiences of survivors of sexual violence and supports the action of the perpetrators through individual, social, and institutional channels. Um, I was also curious to see if they were given the resources of what to do if they were a victim of sexual assault, such as getting counseling. And shockingly, 87.5% said they weren't given the resources if that were to happen to them. Again, with the resources, I wanted to see if schools are providing them, where to get access to that in the community. 93.8% said they weren't. Um, I was also curious to see if they think schools should provide that for them. 68.8% said they did wish it was provided to them. 18.8% said they didn't wish it was provided for them. Um, the orange right here is a prefer not to say, and the green is a written response. The respondent said high school age students will have sex regardless, so give them the resources they need to prevent STDs and pregnancies. Um, I was curious to see if they responded no to some of the things they didn't learn, if they wish they were, if they were taught about that, and were if they were sorry, if they were taught about that, and if they wish they were provided where to get the resources to those things. 66.7% said they did. 13.3% prefer not to say. Um, these other colors are written responses. Um, one respondent said they wish they would have learned about birth control and STIs. Another respondent said they wish they were provided better resources. And this respondent wrote, "I didn't understand the power that women have in relationship, and if we said no to sex, then it should be respected." Based on the survey responses, students are not being taught an inclusive sexual health education curricula. They are not being provided the resources they need in order to have a safe and healthy sex life. Many reported learning about STIs and consent, which is important. Um, one respondent reported, "Some of the things we were taught about, I don't feel were taught adequately or comprehensively." Schools are also failing to provide students on where to get access to the resources they need in order in their community, such as birth control, Plan B, condoms, pregnancy tests, rape kits, STI testing, and medication for transitioning, and etc. Um, a respondent quoted, high school age students will have sex regardless to give them the resources to prevent STDs and pregnancies. I interviewed a teen mom. She reported only being taught about sexual health once, and that was in elementary school when she was in the fifth grade. Her school did not teach about all the options of what to do if she was to get pregnant and did not provide the information of where to get access to those resources. While pregnant in school, while pregnant, her school did not provide her the knowledge of where to get access to resources she needed in order to have a safe and healthy pregnancy. I asked if she believes that schools should provide resources to prevent pregnancy, and she stated that she strongly believed that schools should provide birth control, Plan B, condoms, and pregnancy tests to help prevent teen pregnancy. Continuation with the interview. She did express that she had a teacher that really understood her and helped motivate her to succeed in school. She reported feeling that there is a negative stigma towards teen parents. I asked if what can schools do to help support teen parents. She said, "I believe that schools should have support groups or meetings, free childcare, so that teen parents can attend school and graduate, so that both them and their child have a future." I also interviewed a student who is a part of the LGBTQ plus community. Um, I was curious to know if in his class if they were taught about queer sex. He reported that in his class queer sex was briefly mentioned, but the teacher admitted that it wasn't required. He stated, I wish I was already questioning my sexuality by the time we were learning about sex ed in high school. They didn't go over much about queer health, which made me want to stay in the closet even longer. He reported not being properly taught how to have a safe and healthy sex life as a then questioning teen, because what they were taught was abstinence only is key to avoid pregnancy, and STDs was to avoid sex in general. Um, he didn't learn about PrEP or PrEP, so he had to research it himself. I asked if he thinks schools should provide students with ways to prevent STIs. He stated, all students should have access to free condoms and make it easier for students to have access to things to prevent STDs. He reported that they were told that if they ever wanted to have an STI testing, to talk to their doctor. He expressed that that wasn't really helpful information because not many students will feel comfortable talking to their doctor about sexual health as a minor. He mentioned that in sex ed, they were told that AIDS appeared more in the LGBTQ plus community, but that the straight people get it too. However, he was also told that gay people spread it faster because they have multiple partners compared to straight couples, which as a questioning teen made him terrified to be gay. He expressed feeling awkward in sexual health class because when queer sex was brought up, he heard other students laughing and making jokes. A quote from him said, I felt like I was teaching the queer sex portion by myself, as my friends in that class would ask me questions and I would have to explain how gay sex works. He, he didn't feel prepared and wished that they went more in depth from teaching about healthy relationships to how to prevent the spread of STDs. Based on both the survey responses and my interviews, general themes included that wasn't very inclusive. Students did not have access to the resources and they wish they were. The knowledge of STI is being taught, and they also had expressed the feeling of being unprepared. Final conclusions. Schools are failing students by withholding all the information they need to be safe while being sexually active. Students that are either questioning or open about their non-heterosexuality are feeling excluded. Teaching abstinence only puts students at risk of getting STIs or getting pregnant. Rape culture needs to be talked about. Um, Students need to have resources available for them, such as counseling, contraceptives, pregnancy tests, and testing. If schools don't want to or can't provide students with these resources, they should at least provide them with the information of where to get access to those resources in their community. Um, Next steps and recommendations. Schools need their sexual education curriculum to be more inclusive. A respondent suggests that health education be taught in every grade so that students are being taught everything they need to know. Another respondent says schools should provide free condoms and make it easier for students to have access to things to prevent STDs. Another respondent mentioned, um, I believe that schools should have support groups or meetings, free childcare so that teen parents can attend school and graduate so that both them and their child have a future. Schools can even partner up with local groups that can help queer youth and teen parents, including such as the following: a local Planned Parenthood, Young Parents Program, National Alliance on Mental Illness, and support groups. Here's the citations for my literature review. Thank you.